So, my dear friends, again here I am with a new video of NEET PG 2020 memory based questions and more than 150 questions. So, from here, you can analyze what is going to be happen next because you can easily calculate your score. So, without wasting your time, I quickly start with the questions. So, first question, which of the following is late sodium channel blocker? Answer is ranolazine. Second question, patient with neck rash with excessive maze, that is due to niacin. Next question, how much time after admission patient is said to have nosocoid infection? Answer is 48 hours. Clinical question featuring child playing football with shrunk spleen, then answer is sickle cell crisis. Current global pandemic alert is due to H1N1 avian influenza. Mind it. Maximum work hours for a person including overtime in the factory act is, answer is 60 hours. Mind it, many of the friends will do the mistake of by selecting 48 hours, but it is 60 hours. So mind it. Next question, blood bags are discarded in which category? Bags, yellow category, right? Now vaccine to be given after the disaster, mind it, after the disaster. So it is vaccine against the tetanus. Now project Monica. So I think it is one of the trending question in all the social sites. What is Monica project? So monitoring of trends in CVS disorders. Next question, extended benefit for TB in ESI Act is 2 years. Next question, a person report 4 hours after having the clean wound without laceration. He had taken tetanus 10 years before. Now what is the next step of management? So it is very simple, single dose of TT. Next question, vector for Zika virus is Aedes aegypti. Next question, patient with diphtheria at home, another sibling 3 years old. Mind it, another sibling which is 3 years old, fully immunized, then what do we have to done? So answer is nothing is required for 3-year-old sibling. Now which of the following not a post-coital measure? Mind it, not a post-coital measure. Then answer is tenozole. Type A bioterrorism is Bacillus anthracis. Mission Indradhanush is for universal vaccination. It is a very common mission which can be frequently seen if you visit any CSCs or PSCs. Next question is if the median is 200, standard deviation is 20, then 68% fall between, that is very simple, between 180 to 220. Next question, all are correct for JE except JE, that is Japanese encephalitis. So humans are not the reservoirs for it. Which of the following based on behavioral sciences? Then answer is management by objectives. Quantitative methods include what? Cost benefit analysis. Monitoring of the air pollution is by what factors? By SO2, by lead, and by particulate matter. Next question is variation of the data is compared with another data set by coefficient of variation. Coefficient of variation. Next question is differentiate between the incidence, that is exposed oblique non-exposed. Exposed upon non-exposed is attributable risk. Next, monetary benefit is measured by, mind it, monetary benefit is measured by cost benefit analysis. Next question is prospective screening is done in immigrant screening. Next, researcher want to prove COPD and smoking relation. Then this study designed is called ecological study design. Next question, the upward extension of thyroid swelling is prevented by, mind it friends, it is prevented by which muscle? Yeah, which fascia which is attached to the thyroid cartilage, and is pretracheal fascia. Meiosis occurs in, very well you friends know all in gonads, but according to options, adult ovary is the very best answer. A patient is presented with clinical features of ataxia incoordination. So it is very simple. The lesion is in its superior cerebellar part. Now I tried to make the diagram. I know it is very not very well drawn, but instead I try to point out some important things in this diagram. So this A muscle is levator scapulae muscle, and it is supplied by, the question is, it is supplied by dorsal scapular nerve. Now identify the type of the joint in the given picture. Now this is the type of joint in the given picture. So the image is showing the costotransverse joint between ribs and vertebra. So answer is symphysis. You all know very well, it is a very simple question. The reason for long left recurrent laryngeal nerve is due to persistence of which is a very good question from the embryology. So the answer is fourth arch. A patient which is presented with extension of the MCP joint and flexion of interphalangeal joint, which muscle is affected? That is interossei and lumbricus. Now next question is, where is the highest oxygen concentration in fetal circulation? So this question is also very tricky. That is IVC. Answer. Ligation of the common hepatic artery will impart blood supply in. So answer is the right gastric and right gastroepiploic artery. Next question. A patient presented with weakness of right side of the face with loss of pain and temperature, pain and temperature sensation of left leg. Mind it friends, it is left leg is lost. Now where is the lesion? So it is in the lateral pons, as we remember with the rule of 4. So right lateral pons is the correct answer. Now again I try to point some important cells in this slide. I know the slide is not drawn very well, but still I try to point out some important shape of the cell. So identify the cell marked in the histological image of the cerebellum. Then this is, if you see carefully, then it is a flask shaped cells. So it is clearly Purkinje cells. Next question is, tumor of the uncinate process of the pancreas affect which vessel? Very clear, superior mesenteric artery. Next question, a man was brought to emergency after an accident and injured his peritoneum. He gets an urge to micturate but unable to pass urine. This is because of bulbar urethra, because just posterior to it, the bulbar urethra is situated. Fertilization occurs in which part of the fallopian tube? Very easy question. So it is ampulla of the fallopian tube. Next question, remnant of the Wolffian ducts in female are in broad ligament. This is also very simple question. Next, episiotomy posteriorly beyond perineal body injury, the structure, injured the structure immediately posterior to it. So if you know the anatomy, then you can clearly find out it is the external anal sphincter. Next question, a woman with 18 weeks of gestation presented to PD on abdominal examination. The uterine size was 16 weeks. Minded, it is 16 weeks. On USG, oligohydramnios was found. Which of the following is suspected? Then it is renal agenesis. If you carefully read such type of cases, then you can easily find out that it is renal agenesis. Next question, a child is presented with evisceration of the bowel loops coming out of a defect in the abdominal wall right to umbilicus. Mind it, it is right to umbilicus. So the possible diagnosis is gastrocysts. Photostress test is used to differentiate between macula and optic nerve. This is also memory based question. Which vitamin toxicity linked to the macular cyst and macular edema? So vitamin B3 again. In Congress homonymous hemianopia with Wernicke's hemianopia, it is due to optic tract lesion. Patient come with unilateral proptosis and bilateral abducens nerve palsy. So that is due to cavernous sinus thrombosis. Very common question. Shifting fluid is seen in which? Then it is exudative retinal detachment. Next, the patient come with proptosis, restriction of the eye movement, but was euthyroid. The cause is orbital pseudotumor. This is one of the tricky question. Orbital pseudotumor. Esotropia is associated with hypermetropia. Next question. 55 years male presented with tachypnea, mental confusion. Blood glucose is 350 mg per deciliter, pH is 7.1, then most likely the acid-base disorder is metabolic acidosis, that is the diabetic ketoacidosis. In which of the following conditions would be the cortisol level will be highest? So this is the physiological part. Normal person after waking up in the morning. Next question. Blood stored in the citrate phosphate dextrose is better for transfusion than acid citrate dextrose because fall in the 2,3 DPG is less. This is also very tricky and many of the friends will do mistake in this. So please remember that in this category this fall in 2,3 DPG is very less. When VA by VQ is infinity, this is the sign of infinity, unable to draw it properly. So it means no transfer of CO2 and O2 in the dead space. In preterm baby with RDS, which of the following lipid is deficient? So it is dipalmitoyl phosphatidyl. Next question. Impaired function of aquaporine will result in nephrogenic diabetes insipidus. Next question. 42 years old patient presented with premature aging and present with diagnosis as Werner syndrome. If you know the Werner syndrome, then what is the cause? So it is the short telomere with damaged DNA and loss of the helicase enzyme. Now which of the following enzyme bind with tyrosinase kinase receptor? So insulin is very simple question. Insulin. Serum prolactin level are highest at 24 hours after parturition. This is also a very tricky simple question. Now population with heavy maize consumption results in which vitamin deficiency? Vitamin B3. I think this time NEET PG 2020 is have to some special relationship with vitamin B3. So the clinical, next question, the clinical scenario with megaloblastic anemia on peripheral blood smear showing hypersegmented neutrophil. Vitamin deficiency is vitamin B12. I think NEET PG 2020 NBE persons are listening to me. So now it is vitamin B12. Now the indicator of the air pollution, that is smoke, SO2 and lead. Fibers which are insoluble in water is lignin. All the trans-retinoic acid used in the treatment of acute promyelocytic anemia. Now the image which is showing the spots, sandpaper like rashes. Kindly find out this technical word, sandpaper like rashes in the side of the cheek. So it is very common if you attend your PSM postings. So then in the case of measles, you will see the complex spot. I am unable to draw here. Next question. Child with the age of 24 months presented with fever and chest indrawing. Chest indrawing with respiratory rate of 38 per minute. If you carefully read the PSM part, then management as per IMNCI is the diagnosis is pneumonia and antibiotics are preferred in that case. Now there is a lab report which gives the pH 7.2, bicarbonate 10 milliequivalent per liter, PCO2 is 30 mm of the mercury. Then it is a clear-cut case of the metabolic acidosis. Next question, that inhibitor of the RNA synthesis is rifampicin. There are many debates over this, but the final answer is rifampicin. Next question is renal pathology characterized by the effacement of the epithelioid cells, podocytes, food processes, and loss of the charge carrier protein is due to minimal change disease. If you read in the Harrison, then it is very clearly mentioned in this. It is a minimal change disease. Next question. The woman with 33 years old with heavy menstrual bleeding for 6 months, not controlled by non-hormonal treatment. Then the next management is endometrial sampling. Yes, my dear friends. Next best management is endometrial sampling. If you will attend the intern part, then you will also need to know this. Patient with twin pregnancy with first baby breech, BP 140 by 90 with 1 plus proteinuria and 38 weeks gestational age. Then the management, best management is immediate LSCS. Child on consumption of the food present with vomiting in 3 hours, that is due to Staph aureus poisoning. Next question is skeletal muscle relaxant with competitive inhibition of the nicotinic ACH receptor. Nicotinic ACH receptor is treated by neostigmine. Very common question. Now media for the stool sample of E. coli, common question again, sorbitol. Maximum bactericidal effect of bleaching powder is due to hypochlorous acid. This is also a tricky question. Flufenazine. Next question is flufenazine causing Parkinsonism is treated by trihexyphenidyl. Now next question, most common adenoma in Menwen syndrome present in pancreas. This is also very common question. Next question is terminal ileum and distal jejunum injury produces vitamin B12 deficiency. As we know, if they are injured, then where the vitamin B12 will get absorbed, so that will lead to vitamin B12 deficiency. Soon after the birth, the baby passes meconium. I think this is the ABCD type of question. Now next, jaundice at 5th day in neonate is bilirubin is 15. Then what is the management? So phototherapy is the management. Most common drug causes addiction is cannabis. Now the liquid waste disposal in biomedical waste management is yellow bag. Next question is postmenopausal osteoporosis is treated by OCP. Next question is vitamin B12 is highest in animal products. The clinical question, in which medical condition was stated in which they hint that the wrist joint is spared. So that is osteoarthritis. In osteoarthritis, you all know wrist joint is spared. Clinical condition again in which they stated that femur shaft fracture is present in child, which was very easy to diagnose. So it is embolism syndrome, fat embolism syndrome. Sorry, a child with perineal pain was pre-found test with picric acid. What is the test? The Barberio test. Now NTO nitrous oxide, that is synthesized by the arginine amino acid arginine. Next question, a clinical condition in which thrombocytopenia rash eczema present in the child with lab diagnosis showing decrease in IgM antibodies. Then the diagnosis is Wiskott-Ehrlich syndrome. Most common sign of fungal keratitis is satellite lesions. Perjury, that is the false evidence, is reported under section 193. Very common question. DNA synthesis inhibitor is 6-mercaptopurine. Friends, I am a little bit unsure about this, but I think this is the most common answer. So 6-mercaptopurine is the answer. If you have any debates, then you can comment in the comment box. Okay. Now, next, if adenine is 28%, then what is the percentage of cytosine? It is the, I think, ABCD sort of question. So again, it is 22%. Amino acid which absorbs the wavelength of 280 nanometer at a tryptophan. Next question. A female 16 years old with swelling pain of vagina due to obstruction of the menstrual blood flow. So it is a matter of common sense. I think it is always due to imperforate hymen. Next question. A woman who has conceived a twin before, now present with fetus of 36 weeks, what is gravida and para? So it is very clear, gravida is 2 and para is 1. Now partograph showing decrease in fetal heart rate, increase in uterine contraction. So by these symptoms, the possible diagnosis is rupture uterus during the delivery. Next question is congenital adrenal hyperplasia caused due to deficiency of 21 alpha hydroxylase enzyme. Next question, the strawberry cervix is seen in Trichomonas vaginalis. A 55 years woman present with septate uterus after investigation of HSG, what is the management? So management is hysterectomy. Next question is in Rh negative mother, what are the investigations to be done? So fetal blood sampling is the most common investigation which is used to be done in that case. Next is feeding vessel sign is USG is seen in endometrial carcinoma. Next question, a diagram which is showing the lateral lobe. Just try to make some impression here, not a perfect diagram as I am not a very good drawer. So this is a whipworm egg, that is Trichuris species in zoological name. Next question, a clinical condition showing urine which turned black on standing. This was a hint towards the alkaptonuria. Now the alkaptonuria is due to which enzyme deficiency? So it is also very easy question, that is homogenetic acid oxidase. Next question, the non-competitive inhibition shows Vmax is same in that case, but Km is decreased. Now there is a small pedigree which showing this. So you can easily see the characters which are transferring from generation to generation, and by this method, by this impressions, you can easily find out that it is the autosomal dominant disorder. Now, which of the following nerve is stimulated when scratched at external auditory meatus? Then it is the auricular branch of vagus. Next question, a patient developed acute biliary colic pain which an intern administered an analgesic. So, there is increase in severity of the pain. So, which analgesic is most commonly administered? In that case, only morphine works. Now, question is, you have to actually find out the curve. So, no, sorry, this curve is EtCO2 curve. See the pattern of the curve. This. That means if somebody is intubate, then there are some spontaneous efforts which are seen. So the answer is spontaneous efforts during the intubation. Next question, HBS antigen card principle of test. So this principle of test is immunochromatography. Next question is, which of the following is most likely to be acquired by the traumatic inoculation? The answer is Sporothrix shankai. Next question, two girls in same class are diagnosed with meningococcal antigen. Their 12-year-old close friend is in fear of getting the disease. What advice should be given? So, 2 doses of conjugate vaccines are essential for it. Next question, the maternal antibodies do not provide protective immunity to the neonate. So answer is polio. These maternal antibodies do not provide protective immunity to neonate. Therefore, we select the polio programs and we go for the vaccination of the child. Next question is, drug of choice for invasive aspergillosis. That is a voriconazole. Yes, voriconazole is a type of the IV antifungal which are used in hospital setups for this invasive aspergillosis. Next question, which helps in bacterial adhesions? So fimri, yeah, if you remember the bacterial structure, then fimries are present. Next question, super antigen is produced by which of the following? So streptococcal pyogens. Now next question, I just tried to make some diagram which you have to find out the J chain is there, so which indicates that Ig, A immuno. So, in renal transplant recipients, which are the following organisms causing reactivation disease within 1 to 4 months? That is CMV, cytomegalovirus. Next question is mechanism of the bacterial resistance to penicillin via beta lactamase is by breaks the drug resistance. Sorry, breaks the drug structure. Beta lactamase reducing is breaks the drug structure. Like clinical question in which Viroshi's body were given as a smear picture. That is schwannoma, orphan NEI, nucleus seen in papillary thyroid carcinoma. Next is the clinical question in which surfactant was decreased, that is due to decrease in which of the type of cells. So type 2 alveolar cells. Next question, in which a woman was presented with following symptoms: irregular menstrual periods, intolerance to cold, slow mental function, loss of pubic and underarm hairs, fatigue or weakness. So the diagnosis is Sheehan syndrome. Next clinical case was presented in which symptom of silent abdomen was presented. The diagnosis is paralytic ileus. Twin to twin graft transfer. That is the most common question which many of the friends do it wrong. So the answer is isograft. Many of the friends will do the autograft. Autograft is in the same body, but the here answer is isograft. Now the boy was planning with a trip to hill. Which medicine you will prescribe? Yes, you are all MBBS doctor, so you can prescribe the medicine to boy just before the night. So the answer is promethazine. Large, bulky, friable vegetations on endocardium. This is a very common thing which is seen in infective endocarditis. Now the chronic smoker was noticed a change in endothelium of the lung from columnar to squamous. Now what is this transition called? So metaplasia, common question asked many times before also. Which poison is still found in burned body ashes? Arsenic is the right answer. Next question, which interleukin will activate the IgE? So it's interleukin 4. Now next clinical condition which a child is having a swelled belly. Now which protein energy malformations are detected? So it's the Kwashiorkor. Next, what is the cause of oligohydramnios in the given options? So in the given options, renal agenesis. Next question, which body part is examined to have a tattoo for identification? So skin. Next is water hammer pulse is seen in aortic regurgitation. If you carefully examine this column, then you will see water hammer pulse in aortic regurgitation. Now some image based questions. So this is the question, this is the image which is showing the string of pearl appearance which is seen in herpes labialis due to HSV1. Next, it is the Popo's sign. Next, it's ovarian hyperstimulation syndrome, that is OHSS. Now next image is showing the bilateral hydrosalpinx. Next image, it shows the boot-shaped heart which clearly shows the tetralogy of Fallot. Next, the sign of 3 which can be seen in coarctation of aorta. The next is battle sign, that is the trauma over the mastoid process is clearly seen in this picture. Next is Cobb's angle which is seen in scoliosis. Next is Mickey Mouse sign, common sign is the artery, vein and vein. Next image is showing by barium tapering, the outgrowth from the walls. If you carefully examine this image, then outgrowth from the wall of esophagus is seen. Next picture showing the female condom. Now this picture is showing the efficacy of the A drug, B drug, C drug and D drug. So the potency is increasing left side. Next picture is showing the ichthyosis, lamellar ichthyosis. It is the lamellar ichthyosis. Now this is the infratemporal tonsillar abscess. Now next picture, you clearly see the fungal hyphae are attached over the palate. So this is the oral candidiasis. Now next, I thought you very clearly identify this picture. This is the stipple sign which shows the acute tracheobronchitis. So now these are the questions, these are the overall questions which I gather for you. Hope friends you like this video, and whatever you feel, please comment in the comment box. And